The purpose of neuroanatomy and
This is neurobiology. Welcome to this topic. This topic is one of the important concepts in the beginning of psychiatric nursing. It will deliver us to the understanding of more complicated topics later on. In this topic, we will have an overview of the major anatomical structure, and that means you will have to revisit your anatomy and physiology one more time. And this is for the purpose of focusing on the nervous system. Here we will answer again the question as to how does the brain works. And this will include the physiology, in particular, the neurotransmission process. Here we will also present the current biological theories. We will relate the neuroanatomy and physiology with the mental illness. We will revisit also your biochemistry topic in genetics and heredity. We will incorporate it with stress and immune system and infectious agent to have an overall view of what is mental health and mental illness. For us nurses, for the psychiatric mental health nurse in particular, it is a must that we have a basic understanding and knowing on how the brain functions. And of course, that's involved here, the theories regarding the mental illness. The neurobiology will play an important role in psychopharmacology. Yes, this is one of the favorite board questions and topics in not only in the local examination, but even in the international arena. Here we will have an engagement with the psychotherapeutic milieu, the therapeutic communication, and some other related interventions that nurses are or must be familiar with. So let's start the neurobiology. This discussion is about neurobiology. It will answer the question of how does the brain works and how is the brain being affected by mental illness. The psychiatric mental health nurse must be able to understand and explain all of this phenomenon that is going on with the patient. The psychiatric mental health nurse shall know very well the neuroanatomy and the neurophysiology surrounding the practice of psychiatric mental health nursing. The human brain is said to be the command center of the body. That basically means the brain is the boss of our body. And that this just weighs 3 pounds. However, it controls everything from the beating of the heart to the storage of our memory. This brain contains 86 billion neurons. And that is a very specialized cell that can be triggered by either chemical or electrical signals. And that there are several neural circuits organized differently to perform specific tasks. This brain also contains the glia or the glial cells, not only the neurons. And that this provides an optimum environment for the brain cell to grow. Now, if you may look at this, we are viewing this brain on the anterior side or the anterior aspect. And if we will move it, we are now looking at the lateral side, and the lateral can either be the right or the left lateral. And then if we will move it again, we are now viewing the brain at the posterior side. And if we will be turning it again, we will be looking at the ventral side of the brain. No matter what aspect you look at the brain, you will notice that the brain has so many grooves or furrows at its side. And this is what we call the sulci. And the most part are those what they call the gyri. And there are major big sulci from which we call the fissure, which may separate the left from the right hemisphere. Now, the superficial outer layer of the brain is said to be, this is what we call the cerebral cortex. And there is a difference between that outer superficial layer of the brain from the inner. The outer is what we may basically call as the gray matter, and the inner part is what we call the white matter. For all we know, the gray matter is basically composed of more of neurons, and the white matter is basically consists of the axon. Now, the parts of the brain can be identified based on the location of what part of the bone covers them. That's why we have, we can have here the frontal, the parietal, the temporal, the occipital part. These are the region, and together with the cerebellum at the side, and together with the brainstem. Okay, let's take a look at that one by one. Let's talk about the frontal lobe of the brain. The frontal lobe, as you may look at it on both sides, this frontal lobe is said to be the largest lobe of the cerebral cortex. And this frontal lobe is primarily responsible for an executive function. Meaning, when I say executive function, these are primarily responsible for many behavioral traits that we consider as uniquely human. There, we will see that this frontal lobe is responsible for higher order thinking. That simply means that the decision making, the motor control are all associated with this frontal lobe. And that the frontal lobe is also responsible for the emotions, for the thoughts, the moral responsibility, the judgment, and the memory, attention, and even problem solving. This is how important is the function of the frontal lobe. And if you will be having a problem with frontal lobe, then there's a lot of mental problem that you will be suffering from, like that of attention deficit hyperactivity disorder, the dementia, the schizophrenia, the mental abnormality. These are basically what you will be suffering from if you will have a problem of the frontal lobe. That's why what you're seeing in some other telenovela or some other drama, whenever there happens to be accident and the frontal area will be the one that will bump, then there's always a story that will come out like the amnesia. The amnesia story is true if the frontal lobe will be affected. Now, further talking about the frontal lobe, there are still many other parts of the frontal lobe, such that of the prefrontal lobe. The prefrontal lobe is an outward forward part of the frontal lobe. Then we have the premotor part of the frontal lobe, premotor cortex as we call this in any way from the word itself, motor. It maintains the complex movement like the grasping of the hands, and somehow it helps in controlling your posture. Okay, and it also plays an important role in decision making. Now, another important part of the frontal lobe is that of the motor cortex. Now, the motor cortex is primarily responsible for controlling the muscle contraction. Okay. And basically, another important part of the frontal lobe is what we call the Broca's area. I want you to take take a look at this closely, this is what we call the Broca's area. This is only a small region in the frontal area. And there is a production and coordination of speech. It is named after Paul Broca during the 19th century. This is where we organize what we're going to say. That is why right now I'm able to open my mouth. I'm able to move my tongue and my lips. I'm able to move that because of this Broca area or the Broca's area. Patient who is suffering from Broca's aphasia can comprehend language, but the problem here is they cannot use the language to respond. That's very pathetic. That's very difficult. No, can you imagine if you suffered from stroke and the Broca's area was that part that has been damaged? Okay, you may be able to hear what people are saying to you, and you may understand them. But the biggest problem there is that you cannot respond to them by saying a word. You cannot use the language to respond. Okay. Okay, so that's how important is the frontal lobe of the brain is.
Look at the surface of the
Let's talk about the parietal lobe. The parietal lobe occupies the backward superior portion of the brain, close to occipital. The parietal lobe is primarily responsible for focusing our attention to our senses. Now, when you feel something, the parietal lobe is responsible for that. Then that's what they call the somatosensation. That means whichever you want to focus your attention, let's say if you feel itchy at the left hand and you feel burning sensation at the right hand, your parietal lobe will dictate as to which will you attend to first. And that parietal lobe has many subparts, and one of that is, as you may look at it, that is the inferior parietal lobe. This one is responsible for mathematical reasoning, also for language and comprehension. This is the inferior parietal lobule as a part of parietal lobe. Next to that is we have here the superior. If before there's a superior, now before there's an inferior, this one is a superior parietal lobe. This is responsible for somatosensory cortex. When you want to identify object, let us say for instance, you're going to touch something that is long, something that is thick, something, and you will realize that that is a pencil, and that is a somatosensory function of the superior parietal lobe. So parietal lobe is responsible for that, identifying the object by touch, and you will get the piece of information from the superior parietal lobule. This one is a precuneus, also a part of the parietal lobe. Okay. And the last part of the parietal lobe is what we call the somatosensory cortex. Now, if you may remember during your anatomy, if you get familiar with the word homunculus, now for every part of your body, there are corresponding sensation to this part of the somatosensory cortex. Okay, it will receive the information from touch receptor located through your skin. Let us say, for instance, homunculus is what you have seen in your anatomy book, where there is a lips, there is a hand, there is a genitalia, there is a foot. To whatever part of the body that I will touch you, there will be a corresponding sensation that will be determined by the somatosensory cortex, which is a part of the parietal lobe. So this is how magnificent your parietal lobe is. It is very responsible for the sensation that's coming to your brain. All you have to do is to focus on which one will you attend first. At this time, this is the temporal lobe. Temporal lobe, when you hear the temporal lobe, it is associated generally with primary auditory complex. That means your temporal is primarily located at the ear, and that the basic function would be to interpret the sound, and that is primary auditory cortex is all about. Now, temporal lobe is this big. This is a bilateral area of a ventral part of the brain that houses not only the auditory, but even the emotions, language comprehension, and some memories. Okay. Now, what is very familiar about the temporal lobe is what we call the Wernicke's area. This is the Wernicke's area. And this Wernicke's area allows you to comprehend language. And when you comprehend language, this can either be verbal or written. Now, this Wernicke's area can only be found at the left side of the brain, together with the Broca's area. This is basically the counterpart of the Broca's area. Now, if you will most of the questions with respect to neurobiology, psychiatric nursing, one of the favorite questions there is about the Broca's area and the Wernicke's area. And what do you call the problem? The problem with Wernicke's area and Broca's area basically is what we call aphasia. When we say aphasia, that is you are losing the language, meaning you cannot express yourself. And when that happens, damage to Wernicke's area, okay? So damage to Wernicke's area or a Broca's area can be brought about basically primarily by a stroke. If a patient suffers from stroke and the damage is concentrated or focused either on the Wernicke's area, which is the temporal lobe, and the anterior part of the frontal lobe, left side, that would be damage to the Broca's area, and that is aphasia. As I have mentioned earlier, when you have a Broca's area damage, you may hear what the people are telling you, but the problem is you cannot reply back. Or if you may reply back, you have an aphasia, you really have a difficulty of saying a word because it controls your mouth. You cannot open your lips, you cannot move your tongue, you cannot move your jaw, and you cannot produce a sound. That is a Broca's aphasia. But if it is Wernicke's aphasia, then the problem is you cannot comprehend what they are saying, what they are writing. And this is an aphasia from Wernicke's problem. And that is the counterpart of a Broca's area. Now, there's a mnemonics being used here. No? When you hear the word, if you're going to take the examination and you don't have to be confused about the Wernicke's and the Broca's. Broca is, it sounds like broadcast. It is difficulty of saying because you cannot move your mouth. And Wernicke sounds like here, Wernicke's. And that is, you have a problem with perception of the language and auditory sensation. So you don't have to be confused between what is a Broca's aphasia and a Wernicke's aphasia. Broca's is you cannot broadcast, you cannot speak with your mouth. And Wernicke's is you cannot hear, you cannot comprehend what is being said, or you cannot comprehend what is being written. That's how you will easily remember Broca's and Wernicke's. Let's go to the occipital lobe. In the occipital lobe, if you may look at it, both on the left and on the right side, okay, you will see that's the highlighted part. This is what they call the primary visual cortex. And this primary visual cortex is the part of the occipital lobe which is responsible for receiving the visual information. Now, if we will look at the occipital lobe, this is how big it is. The occipital lobe primarily is responsible for visual information or visual signals. Okay, the visual information will arrive at the occipital lobe, and that is coming from the retina via the thalamus, And as you may see, this will be responsible for the detection of colors, for the detection of edges and the movement, and for our field of vision. It will tell us the details of what we are seeing. Let's say, for instance, you are seeing a lady from afar, and as she comes closer to you, you then realize that that lady is your mother or your bosom friend. This is how the occipital lobe is working with respect to the visual information as it decodes the visual signals.
Here, just caudal to the thalamus, contains the large fiber bundles.
We are now staring at a structure called the limbic system. The limbic system from the anterior view, from the lateral view, on the top view, and the ventral view. Now let's take an even more closer look at the limbic system. This is it. The limbic system actually is a large group of a brain specialized structure deep-seated within the subcortical layer. And these are responsible for motivation, for emotion, and as well as learning. It carries on a lot of function. And this limbic system, as I've said, is a large group of brain structure. This may also include structures like the olfactory valve, the hippocampus, the amygdala, the hypothalamus, the basal ganglia, cingulate gyrus. That's the limbic system. It's too many to remember. However, I just want to focus on two important structures that is related with psychiatric nursing. Particularly, number one, I would like to focus on what we call the amygdala. There you go. Here's the amygdala. Okay, from the top view, and let's try to single that out, clear that out. Amygdala, to me, it looks like an almond-shaped structure within the brain, and it works hand in hand with hippocampus. And this particularly deals with memories, that is a long-term specific memory. And particularly, this is responsible for emotional memory or events. Episodic memory is what we call. Now, if you feel like you are too dramatic, just some petty things, some little things, you cry on things, then the amygdala is the culprit for that. If you're just watching a telenovela, a Korean novela, and you feel like you're drowning in a sea of tears, then indeed you are dramatic. And your amygdala is the culprit for that. Now, another thing aside from amygdala is what we call the hippocampus. Let's take a closer look at the hippocampus. This is the hippocampus from the ventral view, anterior, on the lateral view, and the top view. This is what we call the hippocampus. It looks like this hippocampus is taken from the Greek word hippocampus, meaning seahorse. But to me, it looks like a horn. And these structures are responsible for a long-term memory as well. The long-term memory, such that of, if you still remember your wedding day. Now, for students like you, probably you still remember the very first time that you were able to ride a bicycle. And the even most remarkable, when you had your first kiss. Whoa. That's why you cannot forget your first love. Never mind. Everything that's first. That's the role of your hippocampus. If you still remember those vivid memories in your head, and you cannot get away from that, it keeps on haunting you. That's a long-term memory that your hippocampus is keeping with you. Now, other than keeping all those long-term memories, hippocampus is also responsible for creating a mental map in you. If you're really good if you have this, what we call the mental map in your head, you wouldn't need the Google map. You wouldn't need the Waze apps. You have now arrived to your destination. That's exactly what hippocampus is doing. It will give you a sense of a good navigational digital map in your head. And so, the limbic system, we have two important structures, namely the amygdala and the hippocampus. So that's it.
in the coronal horn of the lateral ventricle.
You're now looking at a structure called basal ganglia. Basal ganglia are group of specialized structures deep within the subcortical hemisphere of the brain. It is in the deep cerebral hemisphere of the brain. And this is composed of subcortical nuclei that is capable of dopaminergic neuron activity. The basal ganglia, let's take a look at the basal ganglia. There are multiple components of the basal ganglia. They are structured group cells or group structure, special structure within the brain. And they are composed of, let's take a look at that. Let's look closer. Basal ganglia is composed of the sixth structure, the caudate nucleus, the globus pallidus, the nucleus accumbens, and the putamen, substantia nigra, and the subthalamic nucleus. There are six structures which are considered to be paired. And this basal ganglia is primarily responsible for the voluntary movement, together with your posture, together with the speech formation. They play a role hand in hand with the cerebellum. Now, what is remarkable about this basal ganglia is I will just give emphasis on two particular structure of the basal ganglia that plays an important role, and this is what we call the caudate nucleus. I want you to take a closer look at the caudate nucleus. This is caudate nucleus. They are paired. Okay? And they relay information to the cerebral cortex. And most of the function of this caudate nucleus is to start a signal related to decision making, related to motivation and motor control. Now, if you may notice, there are particular behaviors such as the reward and the punishment. Now, this is the basic structure in the brain that coordinates, that handles that information. When you are being given a reward for such a good deeds, an accomplishment, or even when it is a punishment, this caudate nucleus of the basal ganglia is responsible for that. And that is a unique characteristic of the basal ganglia, particularly the caudate nucleus. Now, another part of the basal ganglia that I would like to give emphasis on is the structure called, this structure, the substantia nigra. I want you to remember this because in psychiatric nursing, it will play an important role later on in our discussion with the topic called the Parkinson's disease. The substantia nigra sends signal to the dorsum striatum. Sometimes the neurons in the subcortical area, particularly the substantia nigra, are being lost in Parkinson's disease. Not only in Parkinson's disease, some other diseases related with movements are being affected if the substantia nigra are being lost in due time. This may also include the Tourette syndrome, if you may remember. That's a repeated motion, that's irritating, annoying. And also the Huntington's disease are also part of those problems that you may encounter due to the problem of substantia nigra. And they all play part in the structure called the basal ganglia. The last few structures that I want to give emphasis on with the parts of the brain that is in relationship with the psychiatric nursing are the following. The thalamus, this is where you can find the thalamus. The hypothalamus, okay, this is the hypothalamus right inside. and then the pituitary gland. This is the pituitary glands. They are all connected together, the thalamus, the hypothalamus, and the pituitary gland. Let's first talk about the thalamus. Thalamus is primarily located in the middle of the brain, and it plays an important role because this is the one that relays information almost about all of our senses in the brain. And that's why it is being called as the Grand Central Station, meaning it's like the on and off button. The information will be relayed to this, and then it will depend on the thalamus whether to receive the feedback or to forward again an action. This is the very function of the thalamus. Thalamus is more than a messenger for the eyes and the ear because it receives feedback. Now, other than the thalamus is the hypothalamus, and this is the hypothalamus. Hypo, meaning that's below the thalamus. Hypothalamus is very known for its function in endocrine system. It influences not only the pituitary gland, but almost all of the glands in the body. The hypothalamus controls the pituitary gland that releases the hormones. And this hypothalamus is also responsible for temperature regulation, for thirst and hunger, your circadian rhythm. And this is what is being influenced by the hypothalamus. And finally, the pituitary gland. Okay, this pituitary gland is the one known to be the master of all glands. Of course, it releases signals from the hypothalamus. Okay, so these are all the important brain structure that we have to know, because we cannot understand the pathophysiology if we don't have a good foundation of your anatomy and physiology of the brain. So we really have to be familiar with this, because psychiatric nursing is primarily related with the brain malfunction. The cerebellum. Let's take a closer look at this cerebellum from behind, inferiorly. The cerebellum is a Latin term for the word little brain. As you may look at it, this is small, yet it contains more neurons than the cerebrum. About 70 billion of neurons can be found within this cerebellum, and highly convoluted if we will look at this. Okay. The cerebellum, to me, it looks like, it resembles like a cauliflower structure. And this cerebellum has taken a center stage for honing the amazing talents and skills, motor skills in particular. That's why there are pianists who can make an alternate rapid movement of their hands. And the gymnasts are able to perform those spectacular skills. And this cerebellum are also capable of maintaining those procedural memories of a learned motor skills. However, if this cerebellum will be damaged by several reasons, one of the most common is stroke or vehicular accident or any form of trauma. This can cause a condition what we call ataxia. Now, the ataxia is defined as the impaired muscle coordination. And when you have ataxia, you will not be able to control the muscle movement. You will have a staggering gait, a widened base gait, and you may be unable to judge the distance between you and the person next to you. You may not be able to know when to stop, that you may breach a personal distance of one person to another. In time, cerebellum may shrink. And this happen mostly for those who are alcoholic. So that's it. That's cerebellum.